So I've created a model here that shows you kind of how the diaphragm works. It's just a plastic bottle with two balloons, and the yellow one represents the lung and the red one on the bottom represents the diaphragm muscle. So when you inhale, the diaphragm muscle comes down, it contracts downward, and as you can see, if I pull it down like this, the yellow balloon expands, and that's because there's a suction that's created and the air can easily come in the top, which would be like your nose, to fill up the lung. And then as the diaphragm relaxes upward, the lung naturally empties out all by itself. So the real contraction is the downward movement of the diaphragm. Kind of cool. And if you look at it in a person, so this would be the yellow balloon, the lungs, and then the diaphragm muscle is here right under the rib cage, the red balloon. And so this is pulled downward like the red balloon was, and then the lungs fill up. These yellow balloons here would expand. And that's the main muscle, but you also have the intercostal muscles, which bring the ribs up and out to the sides, and that helps pull even more air into the lungs. And there's a number of other muscles involved in breathing. It's very important to understand the mechanics of breathing, of anatomical breathing, before you go on to practice advanced pranayama techniques or any pranayama techniques. You have to understand the anatomy of the breathing. And it's great if you understand it to be able to teach it to other people as well. So here is my latest spinal model made out of clay. It is not a perfect creation, but that doesn't matter. It's the exercise of making the clay model that helps me learn and understand more about the spine every single time. So here you can see three vertebrae. Doesn't matter which ones they are. This is bone, the white part, and then this is the cartilage disc, the intervertebral disc here and here that allows the movement of the main spinal column. Now this is towards the front of the body over here. This is on the back of the body, the spinous processes, which you can feel when you reach around and touch your back. And then if you look at these green things, what are those? You have the spinous process, the transverse process that stick out to the side, and then you have these things that stick up and down, and those are the facet joints. So they line up, and if you take this vertebrae off, you can see the bottom processes there line up with the top one of the next vertebrae. And so those slide and allow some movement of the spine also. There's a lot of stability in the spine because the spinal cord is down in here, in this hole. I'm going to show you that in a second. So let's say this yellow bundle of pipe cleaners is the spinal cord, which is kind of like what the spinal cord is. It's a bunch of long cells, long nerve cells, and they go down to the center of this hole in the middle of the vertebrae. So you think about it, when you touch your back and you feel this spinous process sticking out on your back, and then if you were to reach around from the front, say if you were to press right around the navel or below the navel, right in the center, you may be able to sink deep enough to feel the front of your spine. Through the front of your body, you would feel this part of the spine. And then, so that's where the solid, thick part is like a support column in your body. And then the spinal cord is towards the back of the spine. And it's very important, needs to be protected. And these yellow things, which are nerves, come out through these holes in between. And that's where you can sometimes get some problems. If the disc, sometimes this disc will get smashed and move, squirt out the back and press on this nerve root. And then you have pain or electricity shooting down. So strengthening the spine is really important. There are many, many layers of muscles all through here and ligaments holding this structure together and also allowing mobility in the structure, which is really important, especially if you're practicing yoga, but really just for overall general health and consciousness. Here is a model of the back of the hand and wrist. So this is the radius and ulna. Those are the two bones of the forearm. And you can see, remember this is the back of the hand. So there's a little bump there on the radius. And most of the weight distribution, like if you're going to do a handstand, for example, this will rotate here. So in a handstand, it's going to be more like this. Except that these darker bones, the brown ones, are going to rotate up onto here. The pink bones form an arch. Well, they all form an arch, all of the carpals. There's 8 of them. Here you see 7, because one of them, the pisiform, is only seen from the front side. Anyway, they form an arch, and that's called the carpal tunnel. So on the inner surface of your wrist, there's a bunch of nerves. So when you go to do a handstand, this has to stay in an arch so you don't smash all the nerves and blood vessels. Or even downward facing dog. And then this rotates up. Now notice that the real joint here is the radius with these two. And then the ulna, this bone on the little finger side, doesn't directly bear weight. The weight is distributed from the thumb and index finger through this bone here and into the radius. You don't have to know the names of the carpals, but the most important one is this one here, which is the scaphoid, and then this is the trapezium. And those are the ones that directly interface with the thumb. And that's why the thumb is really important, just like the big toe, in terms of weight bearing in the hands. So I have made the digestive tract. I want to show you how it fits in there, even though it is one continuous tube. So it's a muscular tube that goes from the mouth, esophagus, stomach, small intestine, large intestine to the anus. Continuous tube. Now it passes through the diaphragm and it runs behind the heart. So if we take the heart and the lungs out, bye-bye. And then this is the liver, which is a digestive organ partially, but it's not part of the actual tube of the digestive tract. It's like a gland that has a little tube that attaches in. So now all we have left is this muscular tube. And it's quite long, actually. So if we take it out and extend it, you see here is the esophagus, and then it kind of comes into the side of the stomach. This is just an enlarged portion of that tube. And then if we extend out the small intestine, it's pretty long. And then that is continuous. It attaches into the side of the large intestine here. There's an enlarged portion of it called the cecum, and that would be the appendix right there. So if you stretch the whole thing out, it's pretty long. It's probably even longer than this represents. And then it swirls around to fit back inside. So I have made a model of the rib cage, lumbar spine, and pelvis. This pink part here is the sacrum, which is part of the spine and part of the pelvis. and then we have the femurs here. So there's a lot going on in here. And I want to show you first kind of how the pelvis works. The pelvis is made of, in an adult anyway, after some of the bones have fused, it's made of 3 main portions. So you have the right side, or the left side, and the right side, and the sacrum. And those are joined together by the SI joints, which is the sacroiliac joints. This is the ilium and the sacrum. So SI is sacroiliac. And there's 2 of those. So you can see they come together right there. And there's a little bit of movement in the SI joints. The sacrum can sort of rotate relative to the hip bones. Very small movement. And then the other joint is the pubic symphysis, which is here. So there's a little yellow, that represents a little cartilage disc there. Just similar to the discs that are in between the vertebrae. So these are the 5 lumbar vertebrae. And that would be, if you've heard of L5S1, that's the lumbar vertebrae 5, sacral. That's the L5S1. Some people have a disc herniation there or some nerve compression. And this is L4, 3, 2, 1 is hidden up there under the diaphragm. And then you also have the sit bones down here. And this green thing is where the hip joint is, the socket or the acetabulum of the hip joint. And then the femur goes into there and can rotate in all directions. So it's a very complicated structure. Now up here you can see the rib cage, and then I've put in the lungs and the heart, and then this is the diaphragm muscle, and the green thing is the liver. So let's take the liver out, and I've already removed all the other organs. And then I'll show you where the psoas muscle is. So this is the main breathing muscle. You can see it attaches down to around the middle of the lumbar spine, which is kind of right behind where the navel is in your spine. The psoas is like a pretty long muscle that goes from the spine, the sides of the lumbar spine. So it comes in really close to the roots of the diaphragm. And then it goes down, it kind of drapes down over the front of the hip joint here. And then it attaches to the inner part of the femur, which is called the lesser trochanter. And you may be familiar with the greater trochanter, which you can palpate on the outside of your hip. Now I've failed to add the iliacus, which is a deeper portion of the hip flexors. So that's a short part that's originating in the ilium of the pelvis, and it attaches in the same place. So if you had all of them together, it would look more like this. Now keep in mind that you have on top of that, you have all the intestines. So we have the organs. It gets kind of messy, but we're not showing you the organs. These muscles are deep behind the organs. So on top of all of this, liver, gallbladder, stomach, spleen, pancreas, small intestine, large intestine, everything is on top of these deep hip flexor and diaphragm. So those are kind of unconscious muscles because we don't see them, we're not aware of them, and we can certainly learn to control them, but we don't automatically necessarily know how to control them. Kind of interesting. So I have here the scapula, a model of the scapula, and it's a triangular bone. It's pretty thin, as you can see, thin and flat, and it rests up against your rib cage. So if this was your rib cage, it would sit on your back like that. So when you have your shoulder blades sliding down your back, it's sliding down the back of your rib cage. Now, this is the top, and then this is the side. This sticks out, and that's where your arm goes. So that is the glenohumeral joint, and that pink thing is the labrum of the shoulder, maybe you've heard of that. And the blue stuff is just articular cartilage to help it be smooth and nice. So the humerus or arm bone sits like that. Now, what is all this weird stuff on the top? This is the acromion, and this is the coracoid process. What's missing here is the scapula. So the scapula would sit like this. The collarbone would sit like this. This is the scapula. The collarbone will attach here, and that attachment is called the AC or acromioclavicular joint, which is sometimes injured. And then there's another ligament here that attaches these two bones, and it makes a little tunnel. So there's a bunch of stuff that can happen in the shoulder. Sometimes people get arthritis in this joint, or they get a tear in the labrum, and so they have a joint problem inside the joint. And then often what happens is people get a tendinitis in the rotator cuff or maybe in the biceps, and I'm going to try to show that quickly. So the rotator cuff muscles cover all of the sides of the scapula, and they attach to the humerus and help hold it in place. Now this is a special one called the supraspinatus. So it sits up here on the top in this little groove, which you can feel like on the top of your shoulder. And it goes through this hole, okay? And then, let's say this is the inner surface of the scapula in your armpit, basically. So if you dig up into your armpit, you can press on this muscle, which is called the subscapularis, sub meaning under the scapula. And then on the back of the scapula, you will have infraspinatus. That's the spine. So this is supraspinous, infraspinous. And then if you look at the side here, you can see there's another one, a little one that I'm leaving out. But you can see that there's these three muscles, and they attach onto the head of the humerus and kind of hold it in place, right? So they stabilize the arm as it's moving around. And if you carry something heavy, they kind of keep the arm from falling out, being pulled out of the socket. But they also rotate the humerus and do some other things like abduction. Anyway, this is a common place to get tendinitis because this little tendon has to go through that hole, and sometimes it gets irritated in that point. Now I'm going to take these muscles off and quickly show you the biceps, which is another place where people can get some problems in the tendon, bicipital or biceps tendinitis. So the biceps is kind of like this, bi meaning two, it has two parts, and they flex the elbow, and they also flex the shoulder, and so they raise your arm up, among other things. And so in here, the short head of the biceps connects to the coracoid process, and then the long head, look, it goes through, there's a groove in the bone, and there's a tendon that holds it there, and it kind of attaches right on the labrum, really. And so you can see they also would help hold the joint together. But a common place to get tendinitis and to feel pain is right here on the front of the shoulder when you raise your arm. But that can come from a combination also of supraspinatus and the biceps. It's never only one problem. It's always the whole thing together. But anyway, sometimes this tendon can pop out of the groove or get irritated in that little groove there. So that was a quick demonstration of the scapula and the shoulder glenohumeral joint. Complicated joint.